What do you think the kind of burden lung cancer has? Is it only associated with smoking?
Smoking is the most important cause of getting a lung cancer.
What are the symptoms of lung cancer?
The breathing difficulties, coughing out blood, vomiting.
What do you think a person who has quit smoking?
Whenever a smoker stops smoking,
What do you think is the best possible approach towards quitting
to
smoking?
quit one bad habit,
Quitting smoke is too late because I've smoked for years.
as long as you quit,
So smoking marijuana is better than cigarettes.
those who smoke marijuana.
What is your message for people who smoke e-cigarettes or vape? Hi guys, welcome back to my channel, The Prince where we talk about workout, skincare, nutrition and grooming. పాడ్కాస్ట్లు ఈ మధ్య బాగా ట్రెండ్ అవుతున్నాయి కదా, సో మనం కూడా ఫస్ట్ పాడ్కాస్ట్ చేస్తున్నాం అండ్ ద టాపిక్ ఈజ్ అ వెరీ వెరీ ఇంపార్టెంట్ వన్. ఇట్ ఈస్ రిగార్డింగ్ హెల్త్ అండ్ ఇట్ ఈస్ లంగ్ క్యాన్సర్ అండ్ ఇట్స్ అవేర్నెస్. అండ్ ఈ టాపిక్ గురించి మాట్లాడడానికి వీ హ్యావ్ అ స్పెషలిస్ట్ హూస్ నన్ అదర్ దాన్ Dr. Nikhil Ghadyalpatil, who has over 18 years of experience, and he's a senior medical oncologist and a hemato-oncologist. He is an expert in cancer treatment as well as clinical research and medical education, and he has been treating over 10,000 plus patients nationally and internationally who are cancer-specific patients. Sir, first of all, thank you for joining us in this great cause. And since we are talking about lung cancer, spread some awareness about lung cancer so that people know what lung cancer is.
Thank you so much. Thank you for having me here. Lung cancer is quite an important cancer what these days we are grappling with. The reason is the incidence in India and across the world is definitely rising. So for the viewers, it is quite important to understand what lung cancer is all about.
Yes.
And to understand, let us start with what are lungs. So lungs are basically spongy structures which are situated in our chest wall, and their main function is to oxygenate the blood. And anytime, I would say the changes which happen in the cells, which lead to the cells division, proliferation or multiplication, that is what is known as cancer. So it can start with the air tubes or also called as bronchi, or it can also strike the cellular level, which are called as lung cells, and that eventually lead to something called as a formation of a tumor, and that is called as lung cancer.
Yes, sir. And what do you think the kind of burden lung cancer has on India, the population over here, and globally?
So the lung cancer globally is actually on the rise, and that is quite I would say interesting. The epidemiology, I mean the way we say the numbers or the statistics are changing quite dramatically. If you see worldwide, almost 2.2 million people are affected due to the lung cancer. And if you say look at these numbers annually, this is by 2020 data if I am correct. And almost among that, almost 1.6, 1.7 million are the death rates. So
Wow.
as you can say, if you look at the entire year, maybe 2.2 million are the diagnosis and 1.6, 1.7 is the death. So that's quite a stunning numbers.
mortality rate.
Yes. And when it comes to India, India is not very far behind. In fact, in India is again one of the commonest cancers. You can say it's the fourth commonest cancer when it comes to the incidence. And also it comes to the mortality or the death rate. Again, it's the fourth commonest cancer. So it is again quite high. Although I may accept that maybe in India we still don't have the exact numbers or registry, but numbers are getting better for all of us. But that is how it stands as of now. So it's not only a global problem, but also for India, it's quite a significant problem.
So you mean to say it is on a rise in India as well?
Very true. And very interesting to note that even in the women, in the recent times, when you look at certain newer data which is coming up, it's also on the rise in women, and that is quite surprising. So we are yet to know the real reasons behind it, but that is how it is.
Is it only associated with smoking, or are there other issues which lead to lung cancer?
So first and foremost, we have raised a very important point, and the smoking is the most important, I would say, the cause of getting a lung cancer. If you talk about all the numbers, maybe 80 to 90% of the patients who had developed lung cancer may have some history of smoking, so that is quite substantial. But when you talk about smoking, we talk about cigarette smoking, but we also in the same breath, we should talk about what is called as second-hand smoking. which is like also known as passive smoking, which is quite a common thing. You meet your friends, you are through all the styles, you come across, you inhale all that smoke, and that is also one of the reasons of getting a lung cancer. Not only that, there is something called as environmental smoke or pollution, which we are all struggling with.
Yes.
Look at cities like Delhi, which are quite polluted. So these are also quite important reasons of getting lung cancer. Not only that, there are certain toxins, like, when you talk about toxins like radon or toxins like sometimes, there are certain factories. Let us give an example of asbestos factories.
Asbestos, yeah.
It is quite interesting to know that those who are exposed to asbestos for a long time have a high risk of getting lung cancer. Not only that, chromium, cadmium, people working in the glass factories,
Yes.
steel factories, and so on and so forth. So the list is quite long when it comes to the exposure.
Yes.
The bottom line remains, the more the exposure, the longer the exposure for various toxins or fumes, it will lead to some kind of irreversible cellular damage, and that may eventually lead to development of cancer. I haven't completed as of now, the list is still going on. As I mentioned, age, it's again as the age increases, the risk of lung cancer increases. More common in the men than compared to women. Again, it is quite typical. Although, as I mentioned, even in the women, it is on the rise. Some genetic factors, there will be some familial risk factors, and not the least, some old injury to the lungs, whether it is in the form of old heel tuberculosis or some chronic obstructive pulmonary diseases. So these are also quite important factors which are associated with lung cancer. So list is quite important, but as you rightly pointed it out, the smoking remains the giant killer as far as the lung cancer is concerned.
సో స్మోకింగ్ మాత్రమే కాదు, సెకండ్ హ్యాండ్ స్మోకింగ్ అంటే మీరు ఒకవేళ కానీ మీ ఫ్యామిలీ ముందు ఆర్ మీ పిల్లల ముందు స్మోక్ చేస్తుంటే కనుక యూ నీడ్ టు బీ ఎక్స్ట్రీమ్లీ కేర్ఫుల్ గైస్, బికాస్ సెకండ్ హ్యాండ్ స్మోకింగ్, యాజ్ డాక్టర్ సెడ్, ఈజ్ ఆల్సో ఇంజూరియస్ అండ్ ఇట్ మైట్ లీడ్ టు lung cancer. Let's head to the next question. What are the symptoms of lung cancer?
Lung cancer has, I would say, a wide spectrum of symptoms. And there lies the challenge, and also there lies, early possibility of diagnosing lung cancer at an early stage. So we have both ways over here. Unfortunately, in the very early stage, the lung cancer is asymptomatic, and that's a big challenge. Many a times, the symptoms like cough, which can mimic like any other small viral infection, sometimes tuberculosis, and many other allergic conditions.
Yes.
So that is one of the commonest symptom I can talk about for lung cancer. Other common symptoms include breathing difficulties at times coughing out blood, especially after a long time. Some patients do come across this particular symptom, breathing difficulty. While you are climbing a flight of stairs or when you are walking or running, sometimes the patients do feel breathless. They have to stop, and this also can be one of the symptoms. At times, the change of voice. The voice may just changes, which is a normal voice has suddenly changed over a period of time.
Deeper?
Maybe you can say hoarse, very like it loses its, I would say, metal. That can happen. And sometimes it also patients do present with some unexplained weight loss and fatigue, but it is just an incidental symptom, and on evaluation you can come across.
Maybe loss of appetite?
Correct. So these are, I would say, but these are quite common symptoms for many diseases, and also applies to many cancers. So these are kind of more, I would say, generalized symptoms, but there are certain specific symptoms. In addition, sometimes the patient may not present with the symptom of primary lung cancer, but whereas the lung cancer has already spread to some other organs, and patient do present to us directly as a secondary. And how? Sometimes they just come with the back pain, you evaluate them, you do clinical examination, you do x-rays, you do MRIs, and you find some disease sitting over there, which is a spread from the primary lung cancer. So that at times can be a presentation. Sometimes it goes to the liver, sometimes to the brain. So it goes to the brain. Patient do present with a lot of headache, vomiting, sometimes weakness on one side, sometimes seizure. So these are some of the symptoms when the disease spreads to various organs. So these are, you can say, the primary symptoms of per se in the lung involvement. And sometimes when the lung cancer spreads to the other organs, patient at times can present like this.
So when someone coughs out blood, Is it reversible if they have lung cancer at that stage?
Uh,
Or is
maybe
it too late?
no, that's just a symptom. So let us say that it's a manifestation of something happening in the body or happening in the lung. It might be very early stage or it might be late stage. So symptom can be at any stage, any symptom can happen. But in general, when the symptoms are more, or rather I would say the advanced disease is more documented, usually the symptoms are slightly more. But per se, coughing out blood is not a symptom of an advanced disease, but it can be.
Can be.
Sometimes.
Might or might not be.
Some,
It's a
in some
50-50.
cases. You are right.
Sometimes when I hear about people who don't smoke who have gotten lung cancer, I get a question that is it hereditary also? Like, can it be passed on from one generation to the other?
So there is a lot of research which has happened in this particular field. Although there are some cancers which are quite strongly associated with the familial risk, like breast cancer or ovarian cancer. But when you look at the lung cancer, the association doesn't seem to be so strong. Although there would be around 7 to 8% of family members who might elicit that history of having a family member diagnosed with the lung cancer. However, in the clinical practice, that is not the case very often, but these are the numbers which are coming from the science, so it's not a very strong association. Having said that, I must tell you, there are occasions when we come across a family where the father smokes, the son smokes, and then becomes a family history.
Exactly.
So that also might be another reason.
And is there a possibility that someone in the family has a different cancer, but it has spread to the lungs, like you said, secondary organ? Is there a possibility for it to spread to the lungs for the next generation?
It can happen, but it's like what I understand from this question is maybe a family person may be suffering from a lung cancer and another member suffering from some other disease which is spread to the lungs. Yeah, it can happen because when you have a history of some cancer, there is always you get a history of family now.
The markers. Yeah.
You get a family history of cancer that your first degree relative is suffering from a cancer. So there are times when there are certain genes which run in the families which manifest as various cancers. So there are very few genes where it can manifest as breast cancer in some women, it can manifest as lung in some, and some pancreas in some. But they are quite uncommon.
Got it. So heading on, doctor, what do you think a person who has quit smoking, does he benefit from quitting, or can he surpass lung cancer or symptoms of lung cancer?
So I often come across this question, doctor, I have already been exposed to the smoking, so what's the point in quitting now that anyway my cancer
Keep
risk
doing
has increased? But that's not the case. Whenever a smoker stops smoking, the risk of getting a cancer drops to almost 50% over a decade's time. So it is very important that if somebody is smoking, especially for the audience, if somebody is smoking and if you decide to stop smoking, in over almost 10 years time, the risk of you getting the lung cancer or the risk of getting a death due to the lung cancer will drop to more than 50%. So a lot can be done in this regard, especially when you know that a lot of things can be reversed by quitting the smoking. So that is quite important.
ఈ విషయానికి వస్తే స్మోకింగ్ వల్ల చాలా టాక్సిన్స్ కూడా ఫామ్ అవుతాయి బాడీలో, దానివల్ల మీ స్కిన్ కూడా పాడవుతుంది. మనం స్కిన్ కేర్ గురించి ఒకసారి డిస్కస్ చేసుకుందాం ఈ స్మోకింగ్ ఇష్యూ గురించి. అండ్ డాక్టర్, హెడింగ్ ఆన్ టు ద నెక్స్ట్ క్వశ్చన్. I understand there are a lot of people, especially my viewers, who want to quit smoking, and they keep commenting under my videos that, hey, I want to quit smoking. How do I do it? Doctor, what are your thoughts on it? What do you think is the best possible approach towards quitting smoking?
Again, I would say many a times when a patient comes across to me or maybe a relative who wants to quit smoking, it's easier said than done from a treating medical oncologist perspective because we are probably not trained to do that. But I'll tell you how we normally do it. Of course, one is a referral because there are people in the society who are much better than us, who are I would say more like counselors who can tell you.
De-addiction.
Absolutely. More importantly, what I have realized that to quit one bad habit, you have to inculcate another good habit. So that is quite important. If you have come across the book by the name of Atomic Habits, which does mention the same thing, that make your bad habits more difficult and make your good habits more easier. So just to give an example, if you are interested in, let's say, exercise, so you should have your all gear, everything in place on that day. And if
Yes.
you want to quit smoking, you should really lock all your cigarettes somewhere so that you will not be able to reach a way of looking at it.
We understand.
And having said that, that's easier said than done. It requires a lot of motivation, lot of family support, friend support, bit of a counseling. And I always felt that exercise is something where you try to focus your mind from something like a bad habit like smoking and focusing your mind to something which is more healthy. And that is a time you kind of, in that bargain, you try to do as much as possible. And it cannot be a very gradual process. It has to be like a in one shot process. I have seen a lot of my patients or my friends, I would say, those who might be listening, that I have cut down from 10, I have cut down to 5. So I am in the process, but I have seen that really doesn't work. It should be like in a one shot, and you require a lot of motivation. You require a lot of emotional motivation. That okay, I'm going to do it for my close relative or something, and that is probably, I would say, some of the ways how the people try and quit. And there are a lot of successful people I had come across. So it is doable. Requires a lot of motivation, and that is all about it.
Mental strength. So cold turkey is the best way to actually quit smoking, like doctor said. Heading on to the next question, doctor. So even with a large amount of data and research on lung cancer, people are still getting diagnosed in like the later stages of lung cancer. What are your thoughts about this, doctor?
So lung cancer, as I mentioned, has very vague symptoms. So when you say vague symptoms, it can pass on like any other infection or something, and that there lies the challenge where the referral from a small clinic or something to the bigger hospital for further diagnosis or investigations usually gets late, and that happens across the world, and that also applies to India also. Just because of those typical early symptoms where, as I mentioned, there cannot be, at times there need not be any symptoms, or at times the symptoms are like just mild cough, maybe bit of chest pain here and there. So these are very basic symptoms. So that is one of the reasons why the patients do present quite late to the hospitals.
They do not understand.
Secondly, in India, we have a lot of TB over a period of time. Still patients, we get diagnosed with tuberculosis. And many a times that there is such an overlap of the symptoms. Again, it becomes a challenge. In the periphery, we often come across those patients who had come from the periphery where more often than not, they have taken some TB treatment for a few months before the diagnosis of cancer is revealed. So that can happen. And at times, just lack of diagnostic facilities at smaller places,
Rural areas.
especially in the rural tier 2, tier 3 cities,
Yes.
where just because of there are no facilities, so they are not referred for the further investigations, and that is also one of the reasons. So these are some of the common reasons, and more again, one can say that lack of awareness in the general public, that how can I get a cancer? I never smoke.
Denial.
So why should I go to the doctor? It's just now sometimes they feel that whether it's really true or not, or just it's just a thought. So it typically these are some of the important reasons why we do come across patients who actually present at a later stage. So if you really want me to put down in numbers, maybe less than 20% of patients are diagnosed in the early stage. And that's quite a sorry state of affairs.
Very small number.
True.
As we discuss this topic further, are people, they have more myths than facts about lung cancer. So I would like to burst a few myths, and I'll ask you a kind of a rapid fire, but you can always elaborate because this is all about spreading awareness to our audience. So are you ready for the questions,
Absolutely.
doctor?
Go ahead.
Quitting smoke is too late because I've smoked for years.
It's never too late. Let me put it this way. As long as you quit, there is always a chance that you are reducing the risk of getting a cancer, and that continues to improve over a period of time. So if you are still smoking, I mean, not when I say you, not you, I would say the audience.
Yes.
One can always think about quitting the smoking, and there is always will be beneficial in terms of getting better lung function, reducing the risk of lung cancer also.
So low tar light cigarettes or some people smoke mint and they think it is much better than the usual cigarettes. What are your thoughts about this?
It's called menthol.
Yes, menthol.
Yes, it's a menthol, and classically it is called menthol. And it's quite a rage these days amongst what I come across a lot of people,
Men and women.
men and women. You are so right. The issue remains they are equally bad. It's like any other cigarette because it has tobacco. It has all the toxic chemicals. When you talk about toxic, like a tar, which is the real, I would say, culprit when it comes to the lung cancer. Not only that, the menthol, it has that that flavor. I believe there is some flavor to
They
that.
smoke more.
So it's mentioned that that menthol makes you more addicted to the smoking. Also, you tend to inhale much more deeper
Because it's easier.
and the particles are going to go much more deeper in the lungs. Always there lies the risk, as much as whether you talk about other normal cigarettes also. So they are no different as when you talk about the risk of lung cancer.
మెంథాల్ లేదు, లైట్ సిగరెట్ లేదు, లోటార్ లేదు, ఓన్లీ 1 mg నికోటిన్ లేదు. అలాగే మీరు ఏది స్మోక్ చేసినా కూడా మీకు ఈ క్యాన్సర్ అనేది వచ్చే ఛాన్స్ ఉంది. జాగ్రత్త. సో స్మోకింగ్ marijuana is better than cigarettes. That is what people who smoke marijuana say. What are your thoughts about this?
Again, I may not have really formal, strong scientific evidence to talk about it, but there is a bit of a suggestion how the things happen, where those who smoke marijuana also tend to smoke other things like cigarette. So per se, marijuana may not cause, but all said and done, there is something burnt material what you are going to inhale. There is some lung damage which is going to happen. It is more possible or more likely that those who smoke marijuana are also going to couple it with cigarette smoking. So there lies the risk. So it may not be the direct risk, but more of a piggybacking on marijuana when you talk about smoking.
సో మ్యారివానాలో నికోటిన్ కలుపుకొని అలాంటివి చేయకూడదు, అసలే అది ఇల్లీగల్. ప్లీజ్. యూజ్ ఆఫ్ ఈ సిగరెట్ ఇస్ హై దీస్ డేస్. What is your message for people who smoke e-cigarettes or vape and think that it is better than cigarette?
So I do come across a lot of people who ask me this question, more so from my friends who say that, hey doc, I think I'm on e-cigarette. We are moving on to the e-world right now. And I have read that it is much better than when you talk about the normal cigarettes. Now try and understand the e-cigarette or vaping is quite a new phenomenon. So as we understand, whichever insult we are talking about when you talk about any cancer, the insult has to go for a much longer time to eventually manifest as a cancer. So typically for smokers also, it doesn't happen like overnight. It will take some time. Since vaping is quite a new phenomena, the science behind vaping till leading to the cancer is still not developed. So we do not know the answer. But if you ask any sane person what thinking is all about, it is very likely that
It is also going into the lungs.
it's very much possible, but it's just that science is going to give us those questions sooner or later. But one thing for sure, it damages the lungs big time, and that is quite evident. There are enough I would say people who had undergone a lot of treatments for that. So vaping has some other toxic chemicals like anilines, aldehydes and all that. They are equally toxic to the lungs, and lung will undergo what is called as fiber formation, also called as fibrosis,
Fibrosis, yeah.
which itself is a risk factor for cancer. So sooner or later we may come across that information. So if you ask me in one line how good or how bad it is, I think it's equally bad, especially for the kids these days, the college going or the late school going kids. That's quite a rage, I would say, and my sincere advice to all of you is to stay away from it.
Doctor, does talcum powder cause lung cancer?
Maybe a bit of a far-fetched theory. I don't think there is a lot of evidence to say that. Although there was a lot of hue and cry about talcum powder and ovarian cancer, but for now I don't see that as a major risk factor. But again, talcum powder does have something called as silica, and silica sometimes can cause something called as not to all people, but something called as silicosis is a known issue with the lungs, but that is seen with the people who work in certain factories.
Yes.
So I'm not too sure about it right now that talcum powder can cause lung cancer. So that is one of the myths that talcum powder can cause cancer. I think science is not evolved to that extent to confirm that.
So when someone gets lung cancer, most of the people think that they succumb to the disease and there's no going back, and maybe sometimes continue smoking thinking that, hey, it's done. What are your thoughts about this?
So, like most of the cancers, it's just a disease, it's not a sentence. So, when I say that cancer is just a word, it's not a sentence. Remember that. The reason is, if you come across early stage lung cancer, there is substantial cure rates, where in a stage 1, we tend to cure almost 90% plus cancer patients. In stage 2, stage 3, there are also substantial cure rates. The challenge comes when it comes to the stage 4 or advanced lung cancer, where the patients, usually the cure rates are not much there, not much because of the advanced stage of the disease. And these are the patients who will eventually have a longer life due to current treatments, but may not be able to make it because of the advanced stage of the disease. But how the science has evolved in the last couple of decades is quite phenomenal. When I started my, I would say, career many years back, and on an average, our stage 4 lung cancer used to survive for, let's say, 8 months to 10 months to 12 months max come max. Now, if you look at the recent literature from India, or for a matter, the Western world, almost 25% of patients are now crossing more than 5 years. And that's quite a stunning, I would say, scientific advances what has happened in the last couple of decades. And that has been the boon even for the advanced cancer patients, where the patients are surviving with the newer targeted therapies, newer immunotherapies, newer cancer chemotherapies. So a lot of good things are happening in that field also.
Thank you, doctor. And that brings us to the end of the rapid fire. Thanks for all the information that you've given. One more question which I have in my head is, doctor, as we always suggest that prevention is better than cure, can you suggest a few tips for our people to stay away from lung cancer, and how to quit smoking, or how to avoid pollution or avoid polluted areas if people are exposed to factories where they work in? What are the prevention methods that they can take so that they can maybe reduce the percentage of getting the lung cancer?
So, again, quite important, but unfortunately, we all live in the same world, the polluted world, and we have to agree and accept to it. As always happens to all of us, there are always ways where we can kind of steer ourselves away from certain areas or especially certain habits, and that itself can be a very big step towards the cancer prevention. When you talk about lung cancer also, we have talked a lot about smoking, and I couldn't cover in toto about lung cancer and smoking. But as I mentioned, smoking remains the first and foremost risk factor for lung cancer. So it's always for all these, we do so many talks, presentation, the thrust remains on quitting smoking. That is the first and foremost way of reducing the lung cancer risk. Then, as you mentioned about certain exposure to certain toxins, sometimes in the factories. So, there are certain areas where there should be a routine checkup for the people who are at higher risk of getting lung cancer. So, they should be screened more, I would say, commonly at various levels.
So, at least they'll be diagnosed.
Yes. There has been some suggestion of lung cancer screening now, where a screening test means that you pick up the cancer at a very early stage. Should you be at higher risk of getting a cancer due to whatever reasons. So for lung cancer, there are certain guidelines, especially for the smokers who smoke, let's say, X number of cigarettes for X number of years. Then there are certain recommendations. One can always meet their doctor and discuss whether they should undergo those lung cancer screening with certain low-dose CT scans or not. So those are certain reasons. I would say certain ways of reducing the risk of getting, or at least you can pick it up at an early stage. And as I mentioned about smoke, environmental tobacco smoke, second-hand smoke, pollution, risk from the various, I would say, factories, fumes, asbestos, something what we had discussed, how we can mitigate those risks by staying ourselves away from such environments, although it's easier said than done. And last but not the least, I always believe that it's a regular exercise, good dietary habits, maintaining good weight, and these are good nutrition. These are quite important. As we have been discussing about smoking, they are equally important to reduce the risk of getting not only lung cancer, but also for that matter other cancers and other lifestyle diseases like even the heart, diabetes, and etc. So a lot of things can be done from our side to safeguard ourselves from getting for being risk at various cancers.
One more quick question, doctor. It just struck my mind that I've seen a lot of Koreans who use a mask, like wherever they walk in the environment. So, is that a way of prevention, or can it reduce the risk of like we getting lung cancer from maybe pollution?
I'm not too sure because that's the very basic mask what they are using. But that is more being used for infections. And you might see those people more often at the airports.
Yes.
Especially during the transits.
Yes.
So it's very typical. There are many countries where they often use, especially in the, I would say, the crowded areas, they use the mask. More, it has actually increased much more after, of course, during the COVID times, we all probably would have seen that.
Yes.
But as Indians, we again gone back to our old ways. But as you say, the Japanese are very
Japanese and
disciplined.
Koreans, yeah.
So they continue to use that, but I believe it's more for the infections rather than for the cancer.
And maybe privacy.
You can say that.
Maybe he's an actor. You never know. Thank you, doctor. That's it for today. Thanks for sharing awareness with us. Thanks for joining us. And I've gotten a lot of information from you. Hope the audience have also enjoyed all this information, and hope they quit smoking, which is the prime cause for getting lung cancer. Thank you.
So thank you for having me here. Thank you so much.
Thank you, guys. So if you like, share, and subscribe, you need to share it to your friends as well. I'll be very happy. I'll come up with more and more content like this with many more experts. Thank you.